Small business owners in California will see their healthcare costs skyrocket come November. Not a couple years from now, just a few months from now. Many simply won't be able to afford healthcare in the marketplace, or if they do pay the higher premiums, that means they'll have less money to invest in their small businesses or their workers.
Well, then it sounds like you should go after the health insurance industries and find out why exactly they're skyrocketing the costs. Why are they jacking up the costs for healthcare for everybody in that case? Is it because the healthcare providers are just demanding more money? There's got to be a reason for it. And I think the government should be looking into, they're all about price fixing and price capping. Why aren't they capping the cost of healthcare goods and services? Why don't they cap that at, 300%? So if you go into, a hospital or a radiology center and you're getting a simple x-ray, instead of them charging you $800 for an x-ray, even though it costs the radiology entity, it only costs them like $50 to give an x-ray, but they're going to charge your insurance company like $800. Oh, it looks like it ended. That's what they should really be focusing on. If you go and get a CT scan, they're going to bill your insurance company thousands of dollars. $5,000, $7,000, $8,000, $9,000. If you're in the emergency room, oh yeah, it looks like it's over. If you're in the emergency room, they're going to charge you thousands of dollars more for a CT scan than if you just went and scheduled it, despite the fact that it costs the same amount of money no matter what. Whether if you're in the emergency room or if you're going to get it scheduled at a radiology center, a CT scan is a CT scan. Now, I know that a doctor, to read and dictate it on an emergency basis, like they have to have someone on staff and on call or whatever to read it, yeah, that'll probably cost a little more because they can charge a little more for that. Just like a plumber, they can charge more for an emergency call rather than a scheduled call. That's just how the world works. But it's not costing them thousands of dollars to give someone a CT scan from the hospital's perspective or from the healthcare provider's perspective. It's just not costing that much. It'll cost like $150, maybe $200 for a CT scan. Like a CT machine, it costs $2 million, maybe $2.5 million, and they use the same machine for years and years. And they're running 30 patients, 40 patients a day through those in many cases. But yet, they're charging $6,000, $7,000 for each patient. They're charging probably 2,000, 3,000% above and beyond what it's actually costing the facility to provide those services, and that's what they should really go after. Why does it cost $700 for your insurance company to pay for a simple IV when the materials to make an IV probably doesn't amount to more than, $15, $18? Plus the nurse's time, because nurses, they make a lot of money, $40, $50 an hour, but it only takes, 2 minutes, 3 minutes to administer an IV. So we're only talking a few bucks worth of a nurse's time to administer an IV, plus the equipment. So $25? That's probably about how much it costs the medical facility to administer an IV from start to finish, including the cost to ship the IV goods to the facility and everything in between. So if it only costs $25, then why the hell are they billing your insurance company $700 for an IV? And I'm not very far off on that number. I'm not just pulling that number out of my ass. It actually costs hundreds and hundreds of dollars just to get a freaking IV. And it's crazy. Or somebody goes into the hospital for, let's say, a kidney stone. They go into the emergency room. It's $1,000 just to have the bed. Whether if you occupy that bed for 5 minutes or if you occupy it for 8 hours, they're going to bill your insurance company a minimum of $1,000, if not more than that. And at the end of the day, if you have a kidney stone, for most people, they just have to manage the pain until you pass your stone. So you're only there to get pain control, which the drugs for pain control are only $10, $15, maybe $20, and that's it. But your insurance company is going to be billed thousands and thousands of dollars worth of services that you really, I'm not saying you don't need those services. I'm just saying that they're charging way, way too much for it. So I think that's what the government should be working on. They should be going after not only the healthcare industry or the insurance industry, they should also be going after the healthcare industry and really any other industry that bills insurance companies on a routine basis. And they should get to the bottom as to why it's been hyperinflated to such an absurd degree where somebody goes to get a simple outpatient procedure and it ends up costing the insurance company like $50,000, $60,000, $70,000 because it shouldn't cost that much. It's insane. It's absolutely fucking ridiculous.